healthcare is number one. This has been the number one business issue for our 2,100 employers for the past 5 years. In response to this, in October of 2005, we formed our healthcare CEO group, which included the CEOs of Bausch & Lomb, Jasco Tools, Kodak, Paychex, RIT, Wegmans, and Xerox. A subcommittee, which we refer to as our healthcare planning team, which is really the working group of this initiative, was put in place. This group is comprised of the healthcare benefits experts from our CEO group of companies. We have been focusing our energies on local initiatives that will have an impact on quality, cost, and access to healthcare in our region. The team quickly recognized that improving high blood pressure care could have a significant impact on healthcare costs and improve the overall health of the citizens of our community. I applaud them for championing this important issue. The RBA is noted for its work in establishing various cooperative efforts. We clearly recognize that the Finger Lakes Health Systems Agency would be the ideal community partner to advance this initiative, and today we're proud to announce this partnership. I want to recognize Fran Weisberg, Finger Lakes Health Systems Agency Executive Director. Fran, raise your hand. As well as the healthcare leaders in our community who have signed on to work with us and who are critical to this effort. They include Brad Burke, the University of Rochester Medical Center, Chris Booth from Excellus Blue Cross and Blue Shield. Chris is here with us. Lisa Brubaker from MVP Healthcare, Mark Clement from Rochester General Health System. Is Mark here? Yes. Lisa's here as well. Lisa snuck in. Thank you, Lisa. Warren Hearn from Unity Health System. Warren is here. And John Urban from the Greater Rochester Health Foundation. I'd also like to acknowledge key government partners who are with us this morning. Representing Monroe County Executive Maggie Brooks is Andy Doniger, Director of Monroe County Public Health. Andy, you're here. There you go. And Daryl Porter, representing the City of Rochester Mayor Bob Duffy.
Actually, the story is the folks that are really back here, because this is a community-wide effort. Our mission in life is to help people, to significantly and positively change people's lives. One of the best ways to do that is through true community collaboration. Our goal is to be the healthiest community in America, and we're well on our way to doing just that. As Sandy said, our collaborative effort started 5 years ago. 7 organizations, Sandy mentioned: Kodak, Xerox, Bausch & Lomb, Rochester Institute of Technology, Paychex, Jasco Tools, and Wegmans. Together, we have over 100,000 employees and over $30 billion in annual revenue. As we sat together, we tried to determine what would be the first of hopefully many projects that we could work on to make Rochester the healthiest community in America. Led by the guidance of Xerox and Paychex, Jake Fleitz and Larry Becker, we chose for our first initiative high blood pressure. Why high blood pressure? Number one, we thought it would be an easier one to go first, and we know that each and every person in this room today has been somehow touched by strokes, heart attacks, and related diseases. As we said, if we are successful in this first endeavor, and I have every reason to believe we will, then we'll move forward with others. What we decided to do is have a community-wide group get-together, our high blood pressure collaborative. We have 63 high-level, talented volunteers as part of this collaborative from 40 different organizations in our community. And I have to tell you, each and every person we asked to participate has said yes. The attendance in each and every meeting has been extraordinarily high, and the work product of the group has been absolutely terrific. No other community in America has brought together this kind of stakeholder group to do the sorts of things that we're accomplishing today, and I'd like to give you a few examples of why I say that. The World Healthcare Congress, the largest convening of healthcare professionals in the world, 2 times has asked representatives of Rochester to come to tell the Rochester story. Just this past April, Larry Becker from Xerox did just that. We had the opportunity, I personally, to speak before the U.S. House of Representatives Health and Education Committee last summer, again telling the Rochester story. The same story was told to the annual meeting of the Business Council just past September. Business Week magazine, in their front page feature story, talked about some of the things that we're doing in Rochester. And more recently, the IHI, the Institute for Healthcare Improvement, another national organization, invited representatives, many of those who are behind us today, to come to Washington to tell Rochester's story. And in telling Rochester's story, this group shared data that they had gleaned from throughout the country on healthcare costs and related matters. Clearly, it wasn't totally complete. It didn't include every community in America. But I have to say, what was reported back is that Rochester scored favorably in every category, very favorably. What makes it so very special? We have business in partnership with organized labor, with a faith-based community, with the not-for-profit community, with government, with the three major health systems in our community, with the two major health insurers in our community, with physicians and other providers. That you will not find anywhere else in America. So the bottom line is, this group together, standing shoulder to shoulder, in a way that's happened in no other community. The way we talk about this, it's almost like the starting of another religion. It starts by word of mouth. If we are going to change this entire community, we will do it one individual at a time. It truly is much like a religion. So the bottom line for us is, we'll end where we started. We intend, as a group, to significantly and positively change the lives of the people in this community for the better. And now I would like to introduce my friend, my colleague, Wade Norwood. He is the Director of Community Engagement at Finger Lakes Health Systems Agency. Wade?
Thank you, Paul. Thank you very much. Let me just say that the Finger Lakes Health Systems Agency is delighted to be working in partnership with the RBA in this critical effort. The High Blood Pressure Collaborative is a community-driven solution to a community-wide health issue that affects about 1 out of every 3 men and women in the greater Rochester area, and I myself am included in that number. Today we are launching our initial public efforts to help improve high blood pressure care. First, we're calling on the community to take part in an online survey which will help us develop a communications campaign that will raise public awareness and help us understand community attitudes about this disease. Our hope is that the survey responses will give us insight into people's understandings and attitudes so that we have the invaluable resource of really understanding our community. This is a significant step forward, and I extend my appreciation and all of our appreciation to those representatives, Dr. Gangemi, Dr. Nazar, Dr. Visignano, who are here today, and their colleagues. We will launch a learning collaborative that will allow physicians to share best practices and to share understanding of blood pressure control strategies. And this summer, we will be working with our community partners to begin a series of free blood pressure screenings that will take place throughout the community. And in addition to the wonderful work that Rosa Lloyd and the Kidney Foundation has already brought to launching that, today I was successful in twisting Zola's arm, and 1199 will be joining in this work as well. So please stay tuned for more details on when and where these screenings will take place. These efforts are just the beginning of what will be an unprecedented collaborative effort to control high blood pressure and to ultimately save lives. We will be successful because we have the support and the active involvement of the entire community. And at its heart, healthcare is all about people, it's about relationships, and those relationships are strong. Thank you very much, and I'll happily turn the podium back over to Sandy Harper.